Hello, everyone, and welcome to GAAPP Academy 2025, the very first of this 2025 year, the 2025 GAAPP Gathering. I'm Tonya Winders, the President and CEO of GAAPP, and I'm so excited to be with each of you today as we give you a sneak peek into all the great things we've got planned for this new year. Thank you for your time and your interest in working collaboratively and moving the mission of GAAPP forward, but also moving the community forward as we strive to create a world without allergies, asthma, atopic diseases, airways diseases. So with that, let's dive right in and get started. First off, we do have live translation for today's webinar. So you can see here the steps. If you scan the QR code, then you choose your language. If you are desiring any language other than English, and then ultimately, again, you will be able to listen into your headset live with live translation through the Wordly app. Wordly is our partner on all translations for live events and for webinars like this, like our GAAPP Academy. And so again, we hope that you will get familiar with this very valuable tool. So as we get started, I always like to begin with the foundation of our mission, vision, and values. And so you see that reflected here on the screen. And I think at the end of the day, it really comes down to how we want to interact both internally as a team at GAAPP, but also with our member organizations, with our funders, with all of our community stakeholders. Respect, responsibility, and relationships are the vital, most important values to us. And we want to ultimately work together in that context to create a world where patients with allergies, airways, and atopic diseases can live better. Now, how do we do that? It's by globally supporting and empowering the patient community, but also protecting their rights and insisting on the support of governments, healthcare professionals, and the general public. And when we began our 2025 planning, we started with the feedback from you, our member organizations. And this is a snapshot of that member survey. What you can see is that now we are over 150 member organizations from 80 different countries. And that, again, we've had tremendous growth over the last 4 years. But all of the information that you're going to hear today came from your feedback on the topics of greatest interest, on the needs that you have as member organizations, advancing the work that you do each and every day. So this work is led first and foremost by our board of directors. And again, this is the illustrious group from all over the world. And I'm so grateful to the way that they volunteer their time and give to support the work of GAAPP. And so again, you'll see the board reflected here. I think they're all familiar faces, but certainly Migdalia, Ugo, Ashok, Vildana, and Kwan definitely appreciate your time and service to GAAPP. After the board, we have the GAAPP team, the staff that lead the efforts and the work that we're outlining here today. And so as you all know, we have our 4 mission pillars of awareness, education, advocacy, and research. And so those pillars are led by the individuals that you see here. Victor leading awareness, Kristen leading education, I lead advocacy, and then Ruth leads research. And we do have some new faces that have joined the team and that you saw in an email communicated earlier in January. So starting at the bottom on the left-hand side, that is Fanny Centenac, who is supporting us with communications. And then Stephanie Williams, who is the Speak Up for COPD project leader. Vildana Munchvik, who is leading our digital health and innovations as a consultant to the organization. Shvela, who again, you all know and has been so great in helping with member support and event management. And then we have Stephanie Petty, who's leading all of our social media, and Gretchen McCreary, who is also supporting research and recruitment. So our team has grown. And as we now are into double digits of GAAPP team members and staff supporting you and your work each and every day, we hope that you'll call on us in new and creative ways throughout this year. So we always start with taking a really brief look back and celebrating the achievements of 2024 before moving into 2025. We had 4 main goals set by the board to build GAAPP's overall capacity, and we did that by expanding the team, as I just mentioned, to build your capacity as members through things like GAAPP Academy, the disease communities, and the regional alliances, as well as our annual events that you all participated in, but also to have financial sustainability. And I'm excited to share with you that as we closed out 2024 books, that we did not only exceed our 1.2 million in revenue goal, but we actually achieved over 2.2 million in income and revenue for 2024 and managed our expenses accordingly toward that. So we're coming into 2025 with a very good fiscal situation. The cash flow is there, and we are ready to hit the ground running with these 2025 projects that we'll share in each of the 4 pillars. So this is the one snapshot slide of all the things that we did in each pillar, of the primary projects in each pillar over the course of last year, and it also served as the basis for our 2025 planning. But ultimately, we asked ourselves, what do we want to achieve by 2030? If we're doing a 5-year strategic plan and looking at where we want to be by 2030, it really comes down to 2 major goals. First, reducing morbidity and mortality due to atopic and airways diseases. And secondly, being recognized as that go-to global patient voice. And so the next slide kind of goes over how we plan to achieve that and some of the key activities for each of those goals. Reducing morbidity and mortality, it's things like access to essential medicines, our chronic respiratory disease reports, our quality standards and implementation of those quality standards in the patient charters. It's things like rewarding innovation through activities like ICANN and through our member organization project impact funds. And it's through the innovative, creative work that we're doing in patient education and research. And then the next slide talks about becoming that go-to global patient voice through interactions like with the World Health Assembly in skin and integrated lung health, and working with Global Skin, and also with the NCD Alliance and advancing those works, working alongside professional societies for things like global guidelines, publications, and Congress presentations, also partnering with industry partners on our core mission work, but also on key sponsored projects and programs that we'll go into more detail. And then overall increasing public awareness for these conditions, because we know that even though these are very common and very burdensome for society, they are often lacking that recognition, awareness, and resourcing that we so desperately need. So in looking again at how do we set our key 4 annual objectives for 2025, we want to continue to build out GAAPP's capacity. And that is why, again, we have once again expanded the team to include a new resource for Spanish recruiting, but also the Speak Up leadership, Speak Up for COPD Coalition leadership with Stephanie, social media with Stephanie, 2 Stephanies now to get used to, and then with communications and marketing coming from Fanny, and then the digital health consulting from Vildana. And again, expect to hear from us throughout the year as we identify additional needs and ways that we can expand the team. But we also want to keep at the forefront building your capacity. And so throughout this webinar, you're going to hear more details around GAAPP Academy, our disease communities, and our regional alliances. We set a very ambitious revenue goal of 3.2 million for 2025. And I'm excited to say that we're already in the process of doing those formal submissions and moving the approval of those resources forward. And the board has approved the budget for 2025 with that revenue goal. So now we're going to get into the 4 pillars and the details of the 4 pillars, the projects, the programs, the events that you can already mark your calendar and look forward to participating in. But in doing that, I want to remind you that as for you, our members, we have 2 main goals. Number 1, we want you to feel engaged and supported. So engage within the community, that you're not out there on an island alone, that we are helping you to do the work that you do each and every day. We're building your capacity through things like the GAAPP Academy webinars and podcasts, through supporting people going through the UPATI expert patient program, through our events like the PAG Summits, which you'll hear more about, one in March, one in April, the Sarial Regional event, the ICANN Innovation and Young Researchers event, the AAA Regional event in Eastern Europe, and then, as always, the GAAPP Summit that we'll hold in September. So again, you'll get those exact dates as we go along this time together. I'm also excited to share with you that we're going to be launching a shared professional network. And this is where we will have experts in nonprofit law, accounting, social media, video, websites, all of that you can call on and get free time and in-kind donation to support your work. And so this shared professional network will be in place in February, and we will launch it in our February newsletter, and how to access that as a member. And then we're building out a knowledge hub. And again, you're going to hear a lot more about this from Kristen in just a moment, but this is a platform to really help you as our members connect on a more consistent basis to advance both the regional priorities and your disease area priorities. So I'm excited to hear more about that from Kristen. And then for you, our members, don't forget that we've got impact funds. We have restructured our impact funds, the over 300,000 euros that are dedicated to supporting your work, your projects. And we have innovation projects like asthma and pulmonary hypertension chatbots. And we divided these resources by region based on the need, based on looking at the way that funds are allocated by other sponsors and how we can best support the work. So again, don't forget to go to that portion of our website, the member portal, and apply early and often for your impact funds for 2025. And then again, we will be hosting the ICANN Innovation Summit and Young Investigators meeting in May, and rewarding those young investigators that are advancing the science in our space of airways and atopic diseases. Now, to our regional alliance structure, you can see here the board members that are leading each of the regional alliances. And I also want to introduce Obi, who will be supporting Ugo in the Africa and Middle East Alliance and leading the work there. We are so appreciative of the way that the board members and the alliance leaderships have stepped up to build that community, to advance the priorities of the region across disease states. And so you'll see that we're hosting meetings regionally throughout the year. We're giving you more opportunities on a quarterly basis to engage with the regional alliance leadership. And we will be establishing pillar mentors in each region. So there will be an awareness, an education, an advocacy, and a research pillar mentor in each region within the next 3 to 4 years. We're also building out our professional society membership relationships and what we call our associate members. So this is the alphabet soup of all of the professional societies and the entities, organizations that we work with at a global level across all of the different disease states. And I'm managing these relationships, and they're so very important to achieve that goal of being the go-to global patient voice. Our industry partners. Again, we could not do the work we do without our key industry partners. And it's our goal in working with our industry partners to always exceed expectations, to deliver on time, on budget, whether that be our key corporate council members that you see represented here that support our core mission work across different pillars, or these special sponsored projects and programs that we have on tap for 2025. So a huge thank you to these industry partners, but also a reminder that they are a very important stakeholder in the work that we do. So in looking at 2025, again, this is what I call the money slide, the one slide that kind of encapsulates everything that we are aiming to do in the new year across our mission, our vision, and the 4 pillars, as well as building out the organization. And we're going to dive deeper into each of these areas, but I think that this is always a good reference point, and one that, again, as we have our monthly newsletters, as we have our GAAPP Academies throughout the year, we'll revisit to see how we're progressing. So now I'm going to turn it over to Victor, and he is going to share with us the awareness mission pillar for 2025.
Thanks, Tonya, and welcome everyone to this webinar. I hope you learn a lot about what GAAPP is going to do in 2025 and that you can get to participate in everything that we offer you during this session. So I always like to start talking about awareness to highlight why is awareness important. You have seen this slide several times, but I'm going to keep showing it for years until it's in everyone's memory. So the more people we bring through awareness, the more people that will end up through the inverted pyramid of education, advocacy, and research. More people get aware, less people get educated, even less get to become advocates, and even less get to engage in research. So that's why awareness is always so important for our work and for your work, certainly. So first, let's have a quick look at our 6 main awareness days that you're all very familiar with. As you know, GAAPP produces social media, communication, multimedia assets for 6 main awareness days, which are asthma, eczema, lung day, urticaria day, chronic cough, and World COPD day. Here is a quick overview of how our awareness days participation has increased through the years, which I'm always very grateful on how much you are engaging with them, and I'm very grateful as well that these assets are useful for you to reach out to your community in your own language. We have translated these assets in all these languages that you see here and more. And as you saw this year, we have almost made any record for participation. So thank you very much. And I expect to see these numbers grow even more in 2025 and you engaging for all these awareness days. As you know, these days come with a communication grant of €200 for every time you participate in one of the days, and that's our way to help you to finance those human resources that we all know that you spend in social media and other staff cost. So this is our new baby in 2024. You also was launching our big day, the Chronic Cough Day, that was proclaimed in Tennessee and federally in the US, and we are working to also proclaim it in different countries around the world. So if you want to participate in those efforts in proclaiming the day, please contact us. These assets that we created for this year, they are evergreen, so you feel free to access, share them, use them, and learn through the whole year. This is evergreen. You always can go back to them. They don't expire. And they're always open for you and for your community if you want to learn about chronic cough, how to treat it, how to detect it, and how to live better with chronic cough, and what tools and resources are available for you to improve the quality of life of people with chronic cough. In 2025, we hope to achieve and improve everything that we have been doing during the last 4 years almost. So we want to translate your campaigns for those disease areas or those awareness days that we don't have our own social media assets. So please always come to us if you have a great campaign like the one you see on the screen right now on the left, and you want to have it in different languages or share with your with different audience. We're always happy to amplify, to translate. We also we will continue our work amplifying all the awareness materials and events that we do with our partners in different coalitions like the World Bronchiectasis Day Coalition. And we will also happy to keep co-creating campaigns, education and awareness campaigns in other coalitions like the one you saw, which is the Skin Coalition. Estela is not here, so I cannot make her cry, but this is actually her baby. So we participate. We really get involved in everything that we do with our partners. And all the logos that you see here are our partners that we have in one way or another participated and collaborated during this year, and we plan to do it as well in 2025 and beyond in different manner. Besides those 6 days, GAAPP recognizes, I think, up to 20 or 24. I lose the count because we keep adding every year. We keep adding more to the list. So we through all these years, through all these days that you see on the screen, we share, we co-create, we disseminate, and so we engage with all the days that you see here in a different way. For example, in World Rare Disease Day, we engage with Eurordis and Rare Disease Days and Nord. In World O2 Day, we also have a coalition. So you will see us promoting assets and promoting awareness and education material for all the days that you see listed here. If you want to get involved in any of those, even if we are not the main partner and we're just sharing, please feel free to come to us and ask us, and we will be always happy to connect you with the organization that will be leading the promotion for all these awareness days that you see on the screen. This is my favorite slide. So this is how GAAPP is filling the gap. So through our work during the years, we have realized that there was an unmet need for GAAPP to participate in other areas that were not traditionally our work in atopic and respiratory diseases. So we stepped up our work in CRS with nasal polyps, or chronic rhinosinusitis with nasal polyps, by participating in live events, going to the Parliament, European Parliament, having a webinar that has already more than 10,000 views. We have also tried to reach those unmet needs by creating content in languages or culturally adapted content to regions that probably don't have so much education and awareness assets. That's what we did in World Bronchiectasis Day in 2024. We made a webinar in Hebrew and English to celebrate the day with patients from the region as well. And this is my personal favorite action from 2024, which is supporting unsupported causes. So every year when we detect those campaigns or those events or those unmet needs, so to say, for some of our members that they're working in different diseases that may not have any support from sponsors, they may not have support from medical societies, so they have the sole burden of having to promote and create awareness for those days by themselves. So this is where GAAPP is also willing to help, like we did last year with the first World Latex Allergy Day, which was a 101 campaign, a global campaign to educate all the people in every country about latex allergy. There was content previously that in this area, but it was a little bit more advanced. So we decided, okay, let's go back to the start with every country in the world, and that was really successful. And this is in the center, you will see what I call in my 2025 surprise. We are very honored to engage with the Aspergillosis Trust in the UK to create the first, I don't know if the first, but for GAAPP, it will be the first global Aspergillosis Day campaign together with this organization. And we will select few organizations to also help us to promote the assets and educational assets and tools that the organization has created and has shared with GAAPP, and translate into your own languages. So you will be receiving more information on this very soon. This is this will be launched on February 1st. So if you think like these people do a lot of things, so we do even more. Another of the things that we do that maybe doesn't get so much traction on the social media and everything that we say, that we realize we have to talk about this as well. So we also work in connecting member organizations in the same country to foster collaboration and resource sharing. For example, we found out that some of the member organizations in some African countries, they don't know each other, or they don't know what they're doing and how can they support each other. So this is how we also step in, organizing those meetings and fostering that collaboration and resource sharing. We also do one-on-one personalized calls with member organizations to assess what are their specific needs, how can we support them. GAAPP is always there to support you, so please reach out to us for any question, even if it sounds crazy. Just contact us, and then we will see, like, we can help you up to this point, or we can help you all the way, but we will always find a way to help you to advance your cause. We also working as well in advocacy and awareness support for communities that have no umbrella or they need extra support, like we did with pulmonary hypertension. But there is a few umbrellas there, but we realize that there is a need for translating resources in other languages, less common languages. So that's something that GAAPP also steps in. Also, as another stepping in is our work in Alpha 1 lung and liver, establishing that connection for the disease for both organs. And you will see us working a lot on this area this year. Probably we'll be able to announce a surprise very soon, but that will come a little bit after that. So this is something that you will see us also doing a lot during this year. And this, when you see us acting in these less common disease areas, is because we have been called to. So the partners of the community has said, you need to step in, you need to help us here. And obviously GAAPP always answers the call, and that's why you see us doing so many things. We also have plans to support your efforts in cystic fibrosis, psoriasis, and other disease. I know there's a few questions in the chat. I think we will have a Q&A at the end of the webinar, if I'm not mistaken, as before. So write down your questions and then we will go through them. So before that, and talking about questions, I'm going to pass the baton to Kristen Willard, that leads education at GAAPP, and she's going to talk to you. And thank you, everyone.
Thank you, Victor, so much. And Victor can't see the chat, but what's happening is that people from all corners of the world are saying hello to each other and greeting each other. This is such a nice community. So hello to everyone. And if you do have questions for us, we'll be doing a Q&A at the end if time allows. So please do put your questions in the chat. So let's get started in education. Okay, so Tanya spoke to some of these before. I just want to reiterate these for you because I spoke to that community that's speaking in the chat. And what we want to do is make sure that we're fostering that no matter where we can, everywhere that we can. So as you heard, we'll be expanding those regional alliances or working groups. We are thrilled to be able to do that moving forward. So stay tuned for information about that if you have not received it already. Then through those regional working groups or alliances, we'll be implementing that GAAPP member organization mentoring program. The idea there is that you will, across the 4 pillars, as Tonya mentioned, be able to receive best practices and support and tips for strengthening your individual work, your organizational work from someone who knows that particular area and where you live quite well. And then we are thrilled to expand our community. Just one more I'm going to brag about, Victor, before we move on. We're expanding our coffee chat model. So right now we do that in AD, thanks to Spella, as well as chronic, pardon me, urticaria that I oversee. And what we will be doing this year is adding COPD to that list. And so you might remember at GAAPP Summit how many people we had in the hallway there talking about COPD at their organizations. It was a record turnout, a great conversation. And what we look forward to doing is fostering that collegial environment more formally and more regularly through coffee chats for COPD, pardon me, in 2025. Now we can keep going. Great. So GAAPP Academy, one of our flagship efforts and what you're attending right now. I wanted to show you what the draft agenda is for the first 6 months of this year. This was determined in large part by the responses that member organizations gave to that survey that you did at the end of the year. So I want you to know that we are always listening to you. So what you'll see here, you might notice that the months what we usually had GAAPP Academy, we had 6. So every other month, what we'll be doing is then interspersing that the new content with recap content. So what that will do is we'll pull from all of the different, so let's look at February, all of the different areas in which we have advanced social media instruction and create a recap for you that's more easily digestible, much shorter, so you're able to access that on the go, but so that you have a module during that month and don't have any off time. We want to keep you learning throughout the year. And of course, given that you requested these topics be covered, make sure that we are supporting you there. Let's go to the next. Okay, so I am just thrilled about this one. What I'll be doing this month, or excuse me, this year, is producing a structured training curriculum. So GAAPP, as you know, has so many dozens upon dozens of materials that can help you to thrive. And what I want to do is to put those into a curriculum so that it will guide you step by step through sort of the life cycle of being a member organization. And you can come in no matter where you are in sort of the maturity level of your organization or the age of your organization. Just I'll touch on a couple of these before moving forward. Of course, these will have a capacity building focus. Our idea, one of the two things Tonya mentioned that we aim to do is to strengthen your capacity so that you can do more efficient work, better work, easier work, so that you can support your patient and family communities. I want this to be, we'll jump to practical. I want this to be hands-on and practical so that these are things that you can take off the shelf and use in your everyday work. We don't want this to be theory based and that type of thing. I want you to feel equipped so that you can read things on a Friday and implement them on a Monday, let's say. Mission aligned, I'll use as another example of what I'll be doing. So this will align with your basic mission, no matter where it is that you are in the world and no matter what disease state you work in. So this will not all be disease specific. You don't have to worry about that, but really more about thriving as a nonprofit, no matter where it is that you live in the world. And then lastly, because I think this one is important no matter what sort of side we sit on in this, improvement focus. This will include a way for you to give us feedback so that we can improve this process as we move forward through the years, and the materials that we offer, we can improve those as well. Thanks, Victor. Let's go to the next one. So this is something that the entire team is excited about, and I get lucky enough to present on it to you. So the GAAPP Knowledge Hub will be coming in the first half of the year, and this will be a repository, a hub, a one-stop shop for you, a platform to support all the work that you're doing across all of the 4 pillars that you're hearing about here today. This also was created with your priorities in mind, things that member organizations stated were important to them and things that you needed. And I'm going to touch on each of these because I think they're important for you to know in more detail. There'll be a resource hub. So exactly as it says, a centralized library of resources. Just as Tonya mentioned, we'll have this by disease area, but we'll also have things that are particularly important to you exactly where you live in the world. So think along the lines of things that support your advocacy effort. I want to harken back just for a second to all the lovely comments that were happening in the chat, all the conversations that I was a part of or I was lucky enough to overhear at GAAPP Academy of the organizations engaging with each other. You will now be able to do that in community forums within this GAAPP Knowledge Hub. So we know that that's happening organically in many cases, but what you'll be able to do in this Knowledge Hub is not only have the conversations, right, that you're already having, but be able to interact and network and also work on documents together and that type of thing, which will just be invaluable to us, given that we are working across so many different time zones and sadly not in the same office every day as all of us would like to. Okay, members only content. Also important for you to know that there will be a way to separate content that we make available to the public and things that are just for members, so you can feel secure in that. And then also we'll make sure that the forms that you are filling out for us, which you so graciously do so that we can be efficient on our end, will be further digitalized so that we can make things more efficient and make it more convenient really for both you and the GAAPP team. All right, let's move on to the next slide. Okay, so we were talking really there about member organization education, but now I think let's move in for a little bit and talk about what education we're going to have for your communities. So first, this Understanding Your Medications Hub, we're pretty thrilled to talk to you about that. That is something that's going to be a sort of a new flagship project for us. The idea there is that no matter what condition or conditions that you cover, there will be information on the basics of those medications, about their successful administrations and devices, I should say, medications and devices, their successful use, information about adherence. And what you'll also find here is that there will be a modality for everyone. So think things like text combined with video or using quizzes, which we know engage people. So we'll make sure that this has something for everyone in your community, that it's evidence-based, and that it will be available in a language that is appropriate for where you live and for your patients. We'll also be expanding. I won't go into great detail, but happy to talk about this with anyone who is interested. Victor mentioned seeing more education and more awareness with respect to things like alpha 1, pulmonary hypertension, bronchiectasis. So we're looking at global education in these areas, and you'll see more of that. Making sure that both our MOs and your communities have more research and advocacy education. I think that's self-explanatory, but you'll see a lot of that. We've started that this year, and more of that will be coming down the pike. And then expansion, which is already starting in the several areas that you see after that: steroid stewardship, type 2 inflammation education. We've already made some improvements to that section in January, in the first 2 weeks of the year, as well as expansion of our shared decision making and other digital health tools, because we know that that is both the present and the future of the world in which we all work. I think another thing you can expect this coming year is to see that we will be adding translations for many of these resources and topics, and then filling in gaps that we may have. As Victor said, it's always clever, our gaps in the gap is filling in any gaps that might exist where we are doing something that's too heavy on text. We'll make sure that we have video or interactive infographics or something to complement that, so that it's digestible for everyone. And then lastly, and you can go to the next slide, Victor, so that I can touch on this. I want to remind people that we have a content calendar every month, information for patients in your community and providers in your community. And oftentimes these are the same topics or related. So every single month, this is the calendar for 2025. I generate, or my team generates content that goes out through our social media. And this you can use to your heart's delight. We design this so that not only does it inform the member organization, but that you can take it just off the shelf. You can repost it with a comment if you want, or even just as it is. And this will help, I think, to round out the social media programs that you're already running at your organization. It's really there to help you to be ready-made comments and content, excuse me, and to then further your social media impact. Okay, let's go on to the next one. Okay, so this is my last slide, and I just want to talk with you briefly about getting involved with GAAPP education. How can you do that? Well, here, let's stick with these 5 S's. I will help you to set an education plan if you do not know how, and do not be intimidated. I also have compiled, pardon me, a tips document on how to do this. It's up on our website. It's under GAAPP, it's under tools then, and under capacity building after that. Please search our resources, see what is already out there that you can leverage, and I can help you identify materials if you need them. As I said, share our tools and posts. They are there for that particular reason. Seek feedback so that you can improve your education plan, and you can also then pass that feedback on to us about what you need from us as far as translations, types of materials, and other information. So that, I know that was quick. I look forward to working with all of you in 2025. And now we will go along the journey, and I'll pass it over to Tonya in advocacy.
Thanks, Kristen. Great job, both Victor and Kristen. Thank you for that. And so in advocacy, again, when we talk about advocacy pillar, it's around creating the landscape, the public policy arena working with global organizations, with national governments to ensure that we can get the right treatments to the right patients at the right time with the fewest barriers. And one of the key ways we do that is by participating with the WHO, with the GAARD group, the Global Alliance Against Chronic Respiratory Disease. We are the patient advocacy representatives on GAARD and on the steering committee there, and engage on a routine monthly basis with that steering committee and also with our key contacts at WHO, including Sarah Rylance and the special envoy, Jose Luis Castro. So part of the work there, again, is the resolutions that we're moving forward and supporting. You will see that there is a skin health resolution that's advancing in 2025. And again, at the World Health Assembly, there is an integrated lung health resolution that is advancing for the UN General Assembly meeting in September. So lots of great work on resolutions at the global level to advance care for these areas. The next slide is on the International Respiratory Coalition. Again, we serve on the steering committee, the organizing committee for this ERS-led IRC. It is 19 national coalitions by which many of you are participating. And the goal of the International Respiratory Coalition is to ensure that there are national respiratory plans in place across every country. And again, these 19 are up and running and have specific projects and aims to create national respiratory plans, but also to prioritize research, to reduce inequalities, and to improve that access as well as prevention of respiratory disease. And we'll be participating in 2025 in the IRC Summit and supporting the national coalitions. So if you're a part of one of these coalitions, please don't hesitate to reach out and how we may support your efforts better. The next slide goes over our Speak Up for COPD Coalition. And again, we are entering into our 4th full year for the Speak Up for COPD Coalition. Such wonderful partners that you see represented here. This project will now be led by Stephanie Williams on our team. And again, we are excited about what we have achieved in 2024 in getting a global narrative very well established and aligning on World COPD Day and advancing those messages. But now is the time to actually advance this one step further and to take those global narratives and those global campaigns and tailor them to your needs at the national level to support you in your work in elevating COPD as a public health priority within your country. And so I'm very excited to say in the next slide that we will be hosting a number of patient advocacy summits, and the first being the Respiratory Summit in Amsterdam, March 28th and 29th of the travel day on the 30th. Please mark your calendars if you are a respiratory member organization for this summit. The registration will be going out later this week, and we are excited again for 2 days dedicated to creating your advocacy roadmap for 2030. What are the 2 or 3 advocacy goals that you have, and how can we adapt the global narratives, the global policy and position statements to support those aims and needs? What are the tactics, the stakeholders, the key messages that are necessary to really change the landscape in your country for those living with chronic respiratory disease? And then our second summit that has the exact same aim is focused on skin health. And this will be on April 23 and 24 in Prague, just ahead of the Global Skin Meeting. We are excited about this 1.5-day summit, which really, again, does the same exact thing. It gives those organizations focused on skin disease, like atopic dermatitis or chronic urticaria, the opportunity to create an advocacy roadmap and with specific aims and goals for the next 5 years and tactics that we can evaluate, but also support you in as we advance that landscape and ensure that we get the right treatment to the right patient at the right time with the fewest barriers. And then please don't forget to mark your calendar for the GAAPP Summit. We are super excited that we will be back in Amsterdam on September 25th and 26th for a 2-day full event for GAAPP Summit. This is the opportunity where we bring all of our groups together, regardless if you're focused on atopic dermatitis, chronic urticaria, asthma, COPD, whatever focus area you have in atopic and airways diseases. This is a chance for us to gather as the broader community to learn from one another, to share best practices, and to really get our game plan together for the coming year of 2026. So now I think I'll turn it over to Ruth, and she'll review our research objectives.
Hello, everyone, and I hope I'll meet many of you in Amsterdam. So I'll tell you about the research pillar and how we make sure that we include the patient and the caregiver voice and perspective in everything that we do. So if we go to the next slide, please. This is on our webpage. We did create a research webpage that explains why GAAPP is a part of it and what are the capabilities and what we are doing. So I'm not going to give you the whole list, but the whole idea is to make sure we include that important patient caregiver voice in our work. Go to the next slide, please. So in terms of 2025, these are contracted projects that we already have, is recruiting for at least 10 research studies, advisory boards, and focus groups. We did, as I mentioned, create a research pillar webpage where we are adding content to. I hope you're reading our monthly research newsletters that we sent about the 15th of each month. And we do communicate through social media. You can register for the research newsletter update on LinkedIn, and we do a lot of member outreach as a part of the work that we're doing. We are involved in 2 new community surveys and are working on a focus group this year. So the key aspect for you is that we will be reaching out to you to help us with recruitment, be part of it, engage, and make sure that everything is approved by ethics, anything that we do in human subject research. Next slide, please. So Tonya mentioned to you that we did the member survey before the summit last year, and the majority of member organizations expressed an interest in research, but also some of them very advanced, but some of them lack human subject research training. So what we're doing in 2025, first in 24, we did, Kristen and I did the GAAPP Academy on how member organizations can participate in research. We are involved in funding, and you're aware of the ability to send proposals for support for local projects. We have a research podcast that is out there already as a part of our podcast program. And we are continuing to expand our advisory panel to make sure that we have contribution from all the disease areas that we're covering, allied health professionals as well as scientists. So in terms of the work that we've completed last year, the dissemination is quite important. We have abstracts for at least 8 international conference presentations that we submitted and are submitting. 15 peer-reviewed publications are kind of in the works right now. One thing that's important is a late-term summary. Everything we do, we make sure that we communicate through our multi-channels, and hopefully you will translate it to make sure that the work that patients participate in your countries are communicated to them in their language. The surveys that I mentioned, we are reporting now 3 completed surveys. One is a biologics in asthma and chronic rhinosinusitis. The key point here, we're also just completed atopic dermatitis surveys. The key point that I wanted to make is our ability to run surveys in many questions. These are IRB approved, ethics approved, and we are reporting all of those right now. Next, please, Victor. So cat, what is the cat? Other than the cat animal, it's a great instrument for shared decision-making, it's 8-question questionnaire. It's a way for patients and providers to communicate how someone is doing. We assumed the leadership of the governance board in 2024. And we now have the user guide in multiple languages. We have thankful for 5 industry members that supported the work that we've achieved. And Gold has approved the renaming, mentioning the renaming of the COPD assessment test to the chronic airways assessment test to allow its use in asthma. We are working to expand it to other respiratory conditions. And we do have a postcard that you can download from our website that explains as a video and has QR codes to explain what the cat is. And it is translated pretty much in all the languages that you would be interested in. Next slide, please, is where the Cat Governance Board actually met today at 7 in the morning in the United States. And we agreed to continue to support the validation of the cat in non-CF bronchiectasis. We are adding a US cohort to make sure that the data are acceptable to the FDA in the United States. We are continuing the global implementation of the cat, continuing to update the user guide, translating it. We are building now an online tool for the chronic airways assessment test the patients and providers can use to communicate how a patient is doing. And we will continue to deliver education. We're also working on informing the FDA on the renaming of the cat from COPD to chronic airways assessment test this year. We'll skip this. And my last slide is inviting you to continue collaborating with us. If you have ideas for research, if you want help, we are here to promote, disseminate, help you work on patient engagement and research. And these are some links that you will get with the slides of how to communicate with us. And I will pass this on now to Tonya.
Yeah, great. Thank you so much to the team. Excellent job, Ruth. Really appreciate the work that you're leading in research. And so we do have a couple of slides and we've got some time here. We've got 10 minutes. So if you'll drop your questions into either the question or the chat, we will get back to them. The first question is in regard to this presentation. So we will be following up and sending a full PDF of the slides. So expect and anticipate that. Definitely, we want you to be able to reference this, to mark your calendars and to plug into all the great activities and projects that you've heard across the 4 pillars throughout the year. So definitely you will get a PDF of this presentation with a list of the organizations. The other key thing is please make sure that you are conscientious around the newsletters. So each month we send a GAAPP newsletter. In the 3rd week of the month, then we send the research newsletter. And so please, again, pay special attention and mark down the special activities that are going on each month within that newsletter. We tend to use that to take a quick look back at the last 30 days and a look forward to the next 30 days of the ways that you can get involved or specifically highlighting the great work that you're doing. So if you have something that you want us to share with the broader community, definitely the Knowledge Hub will be a great place. But our GAAPP newsletter is yet another wonderful opportunity to highlight your work that you're doing. Now, one question that came in was in regard to your work and funding. So as I mentioned, the GAAPP board has allocated 350,000 euros of our budget this year towards impact funds and helping to support your work and your project out of our core funding. And to date, the parameters are that we will support a project on average up to 25% of the overall project budget, unless you are in a low to middle income country. And then we will support that project up to 50%. There was a suggestion or a question around supporting projects 100%. Unfortunately, at this time, because of the number of organizations that we have at GAAPP and the way we want to spread the love among our organizations, we're not able to do a complete 100% project support. But if you've got ideas and things that, again, you're struggling to get funded, you're having issues getting funded, please come to us. Let's work together in seeing how we can tap into all of our different funding sources and partners. Maybe we have a creative way to get that work funded, even if it's not 100% by GAAPP. So please don't hesitate to reach out to us in that way. Let's see. One other thing I wanted to mention about in the Understanding Medications Hub that Kristen introduced to you is that there will be some specific education and initiatives around exacerbation recognition. Now, for those of us who are working every day in conditions, even like atopic dermatitis or in asthma and COPD, we know that when there are flares, when there are exacerbations, that oftentimes people sort of underplay that, don't fully recognize what's going on, certainly don't escalate the level of care that they need to better manage those conditions and to ensure that they're not in that worsening of their chronic condition. And so much of that Understanding Medications Hub and the work that we'll be doing in this year will be helpful in identifying when to accelerate the level of care, when to expect more, when to perhaps pursue a different level of care than what you're currently getting. So look forward to all of those as assets within those different resources. Okay, so I see the question from Gundala. Thank you. In regard to the summit meetings, the regional summit, are there advocacy goals for the different regions? So what I will share is that within our most established regional alliances, Sarial and Eastern Europe, there are advocacy aims and goals. And if you recall at the GAAPP Summit that as we met with the different regions, we did try to outline 1 or 2 priorities for each region. Now that we're launching our African region as well as our Asia Pacific region, there will be a more intentional effort in identifying those collective goals and working towards them throughout this year. So we can, in our follow-up, make sure that, number one, you've got the GAAPP Summit summary report that will reference each region and the goals that they set at that meeting. But then secondly, we'll be using that as the baseline for these regional alliance activities and the ongoing engagement. So hopefully that answers the question. We've got just about 2 or 3 minutes left. I do see that we've got
Tonya, there is 2. Sorry, I think there is 2 questions that we haven't. So one is from our colleagues at Santé Live Millau in Togo. So if you're having problems with the GAAPP portal, the member area, you can just contact Spela or I, and we will help you to solve it. And another question from Hadass in Israel, she was asking for the list of organizations. So if you go in our website, in the top menu, you will have member organizations and list of member organizations. And there is a search bar where you can search organizations by name or by country in English.
Yeah, great. Thank you, Victor. Tonya. Yeah, so I love that we've got close to 70 people on the line from all over the world. We've got great representation today, even from those various different regions. And I really appreciate, we know that it's hard to find a time that works for every region of the world. And so I appreciate you guys giving us this hour to give you the sneak peek into all the great things that are forthcoming for this year. Any other questions or comments as we close? All right. Well, what I would say to you is that we continue to not only meet but exceed the goals that are set by the board at GAAPP and hear your voice as member organizations. And 2025 is going to be no exception to that. We are very excited and energized about all that we've got on tap. And we believe that together we will run much, much further than any of us could do alone. Yes, it's slower, and sometimes it's a little more frustrating, but in order to really achieve the big goals, the big aims as a global community that we've set forth, it's going to take all of us working together. And so thank you for being a part of the GAAPP family. Thank you for the work that you're doing in each of your organizations. And please do not hesitate to reach out if we can help you in any way. Thanks, everybody. Have a great day.
Thanks, everyone.
Bye-bye.